So hello and good evening. So I'm Derek. I'm a physiotherapy student working with Joe Southall at JB Occupational Therapy, and I've been learning all about EDS sufferers, hypermobility as well. And I was fascinated by one of the associated symptoms of postural orthostatic tachycardia syndrome, otherwise known as POTS. So I'm going to give you a little chat about what it is, how it affects you and what you can do about it. So I can see from the first slide. So regarding POTS, is exercise hair of the dog therapy, and how can astronauts help? So there's a picture of Kitty there. She's in a good position to begin her POTS exercise therapy, wondering how exercise, which makes her dizzy and fatigued, can actually improve her symptoms. This is the hair of the dog therapy I referred to. Just as drinking alcohol can improve your hangover, exercise can improve your exercise intolerance. An interesting concept. So let's have a look at what is POTS. In fact, let's have a look. So POTS is not a disease in itself. It is an abnormal clinical condition whereby raising the body upright causes racing heart, known as tachycardia, dizziness, fatigue, brain fog, nausea, and difficulty or inability to exercise or do any other type of physical activity for that matter. So why is this happening? Well, when you move from a recumbent position to an upright position, around 700 millimeters to 900 millimeters of your blood, which is about 20% of the total volume, is shifted by gravity down from the upper to the lower body. Your heart needs to recirculate that blood to your upper body, particularly to your brain, to meet its oxygen and energy needs. So when you stand, you get this drop in blood pressure, and it's detected by baroreceptors. These are located just above your heart. And in a normal healthy person, a heart rate increase of 10 beats per minute with a narrowing of the blood vessels creates enough pressure to direct blood flow from the lower body back up towards the brain against gravity. And with that, you get no ill feeling, no nausea or dizziness. It's just a normal function. So in POTS sufferers, the cardiovascular system is unable to compensate for this sudden shifting of blood and gravity, and a resultant lack of oxygen to the brain causes these symptoms such as dizziness. In an attempt to get blood circulating, the heart rate is rapidly increased beyond normal levels. A greater than 30 beats per minute increase, or reaching 120 beats per minute within 10 minutes of standing, will get you a POTS diagnosis. So a large adrenaline surge is required for such an increase in heart rate, and this creates another unpleasant layer of symptoms which you may be familiar with, such as anxiety, palpitations, headache, excessive sweating, and sleep disturbance. So why is this happening exactly? So although the causes of POTS are varied and uncertain, and they include autoimmune diseases, infections, hereditary genetics, can be blunt force trauma to the head. All these can be triggers of POTS. But although you have these varied causes, the physiological results often have typical characteristics such as people have a smaller heart with reduced muscle strength and capacity to fill with blood. This results in diminished ability to pump blood into circulation around the body. Veins tend to be floppier, so can't constrict very well to help pressurize blood flow from around the body back to the heart. And the cardiovascular system can't generate enough blood volume to service the brain when you're standing upright. So this makes exercising difficult, which leads to deconditioning, which further weakens the cardiovascular system and exacerbates your POTS systems. So you've entered into a vicious cycle of worsening effects. So this decondition I just mentioned can actually be a cause of POTS in itself, even in apparently healthy people who experience a drop in physical activity over time. A good example of this phenomena is demonstrated by astronauts undergoing periods of weightlessness in space. In fact, as you can see from the slide, it only takes a month of zero gravity for deconditioning to occur. This has been measured in astronauts. Their cardiovascular fitness reduces by 20% as a measure of peak O2 uptake. There is a muscle mass loss of 10% and a reduction of blood volume by 11%. Because of this, astronauts returning to Earth suffer POTS, and fainting on standing is very common. So that's a picture of the International Space Station in orbit over Earth, and I reckon that's North America below. Tell me if I'm wrong. So what the International Space Station has done, it's facilitated extended stays in space beyond 6 months and even longer. So to counter deconditioning from zero gravity, an exercise program of cardiovascular and resistance training was developed to use in space. So what they do, just like on Earth in the gym, they have these erg bikes, sort of cycles, and obviously it doesn't matter which way up you are in space, so you strap yourself into the little bicycle there and then you pedal just like on Earth, and that will give you a cardiovascular workout. And they've also got treadmills as well, same as a gym treadmill, except again you've got a big harness that straps you down so you don't float off away into, or hopefully not to space, around the room. And to do resistance training, they've got a cable machine. You might have seen them in the gym, often called a pec deck, so a system of cables of weights. In this case, they've also got these big resistance bands they use, and they call it the Resistance Exercise Device, RED. So there you go, it has its own name. So anyway, doing this exercises over this 6-month period turned out to be very successful in terms of deconditioning, although there was still some loss of cardiovascular fitness and muscle mass. The decondition had been reduced enough so that POTS was eliminated when they returned to Earth. It wasn't a problem anymore, it didn't happen. So to see if exercise could indeed be used as a therapeutic intervention in the terrestrial-based POTS population, the space exercise program was adapted and implemented as a 3-month therapy intervention. So results showed an increase in cardiovascular fitness of 8%, again as a measure of peak oxygen uptake. Heart size increased by 12%, with an increase in blood volume of 6%. And after 3 months of the trial, 71% of those who finished no longer met the criteria of a POTS diagnosis, and overall quality of life was reported higher than those using beta blocker drugs as therapy alone. So how is exercise working to counter POTS? Why is it hair of the dog? So endurance type cardiovascular exercise strengthens cardiac heart muscles and stimulates extra growth of the blood vessel network. It also increases the amount of red blood cells in your blood plasma, and these 3 effects increase the efficiency of carrying oxygen around the body and also increases the blood volume to do that. So if you then add resistance training, this style of exercise affects the other important aspect of blood circulation called venous return. So when the blood has reached your organs, pushed there by the heart, it returns via the veins. Now the heart doesn't pump blood through the veins, so it relies on gravity and muscle squeezing against the veins, particularly in the lower legs, to move the blood. So the stronger the muscles are, the bigger the squeeze. So this forces blood flow back to the heart. The more blood is squeezed back to the heart, the more the cardiac muscles are stretched, like a big balloon, and this increases the force of the heartbeat and the blood volume, therefore going into circulation. So this effect of stretching the heart by filling with more blood is known as the Frank Starling effect. So if you want to know even more about that, you can Google Frank Starling effect. It is extremely interesting. And so what we have here, we actually have, this is a summary of the exercise program that was used on our terrestrial subjects. So what you do is initially you discover your base rate exercise capacity, which is essentially moderate exercise. So you're going to be either doing it by your heart rate, so you're going to be looking for exercising at 75% of your maximum heart rate, or you can use what we call a rate of perceived exertion scale, and in that case it will be described as somewhat hard to hard, the amount of effort you're putting into the exercise. And you want to begin by doing that 3 times a week for about 25 to 30 minutes. And then also once every 1 or 2 weeks, you want to add in some more vigorous exercise called maximum steady state. And you can calculate that with your heart rate. You can calculate your maximum heart rate. It's 22 minus your age. So that gives you a figure to work to. Or again, you can use your perceived exertion rate, which in this case will be greater than somewhat hard to hard. It will be very hard. And so you gradually increase that over the 3 months, and by the end of the 3rd month, you'll hopefully be doing it 5 times a week, 45 to 60 minutes per session. And obviously over that time, you want to gradually try and get upright with the exercises you're doing, get more upright. Obviously, only do that if you can. So what the amount of cardiovascular you've got there is basically in line with the recommended exercise guidelines for everybody to maintain health and fitness. So that's what you're aiming for after 3 months. So you'll be there with the recommended amounts. But you also need to do this resistance training, as I was telling you about, regarding venous return. And so when you choose your exercise, you want to do 2 sets of 10 repetitions, and you want to be using a weight amount that's challenging for 10 reps. And obviously, as time goes by, along those 3 months, you want to increase the weight as you get stronger. So you can only do those 10 reps, and that will strengthen your muscles over that period of time. So looking at that, it might seem like a lot of exercise, and indeed it is. There was in fact a 60% dropout rate of those who started, but you have to bear in mind that any sort of cardiovascular rehab program that exists for other diseases, heart disease, atherosclerosis, people recovering from strokes, there are similar sort of dropout rates. It's usually only around 40% of people complete them, carry on, and there's all sorts of reasons, not just the exercise too hard. Other comorbidities might interfere with what they're doing, the drugs they're taking. So it's kind of, you'd expect quite a few people wouldn't be able to do it, drop out. But of those who finished, they did all commonly encounter the same fatigue problems and exacerbated symptoms. So although it's difficult, their perseverance did lead to improvement over the 3 months. So, you know, it's not going to be easy, but it is. If you stick with it, there's a good chance that you're going to improve. So, how are you actually going to find an exercise program that suits you? How do you start? So what we can do, first of all, we can think about the actual exercise position and type, which minimises triggering of your own POTS. So again, this might vary from day to day. You have good days and bad days, better days, but swimming, recumbent bike, a rowing machine, these are all potential exercises which keep you more horizontal. So there's less of that effect of standing up and that drop of blood pressure. So that's something you can work with and try. And then obviously over time you can change those exercise. So if you're on a recumbent cycling bike over the 3 months, you can gradually go to a seated position, or again, probably if you can actually stand up, you can actually stand up and pedal as well. You might be able to reach that stage, but obviously you want to do that gradually and incrementally over time. And you want to find your own base rate and how long you can actually tolerate that. So it might be you're exercising moderately, somewhat hard, but you can only do that for, say, a minute or two, then that's all you do. Don't try and go for the 20 to 30 minutes straight away. Just do what you can. And only add small incremental increases over time. Avoid more vigorous exercise if it's too challenging. And if you do overdo it and trigger an energy crash, make sure you recover well, take as long as you need to get over it. And then if you're going back to the exercise program, go back to the beginning, go back to your starting point. And then try and just make the incremental increases smaller. So you're less likely to hit that energy crash again, that energy wall. And also I know a lot of you talk about people with EDS, you're going to have general fatigue anyway, on top of this, and other sorts of problems. So you want to try and incorporate this exercise regime into your wider fatigue reduction and pacing strategies. For example, you can assign these exercise sessions as red activity days. These are the most difficult for you. And then sort of either side of the exercise session, you can then plan your amber and green activities, which are easier to do. And again, if you are doing, say, a 20-minute cardio session, you can split it into 2 10-minute chunks, spread out through the day. So that does reduce the potential of reaching that fatigue onset point and having an energy crash. You also want to be mindful to compensate your total physical activity by swapping other physical exertions for less energetic ones. Easy. Do some writing, do some painting, craft work, watch Netflix. So, you know, wherever possible, you can swap that out for a more energetic pastime. Just to keep that balance of exercise. Don't add to what you're already doing as part of your exercise regime. And also there's a couple of other strategies you can use which complements exercise. For example, you might have heard of compression gear. So if you wear compression gear during exercise, this actually acts to squeeze on your muscles, and that improves the venous return we were talking about. And in fact, NASA have developed their own compression garment for returning astronauts, and they found it reduced POTS-induced tachycardia by 10 beats per minute on standing, just by wearing this compression gear. Also, the pressure of the compression gear on your skin sends signals to your brain, which can improve its spatial awareness of your limbs. So you'll be less likely to overextend these hypermobile joints, which can cause pain and injury. And then finally, you can indeed improve blood volume by increasing saline and fluid intake, and together they create a favourable osmotic potential in your body, and that allows your veins to draw and retain water inside them into the blood vessels, and that way it actually sort of increases your blood volume, allows more blood circulation around the body. So in conclusion, after that, exercise as hair of the dog could help with your POTS, but it will be difficult and progress may be slow and will need to be incorporated into your lifestyle over the longer term. So some of you probably already have pacing strategies, but if you want to know more, you can always send an email to hello@JB Occupational Therapy and you can get yourself a masterclass pacing strategies where we can help incorporate an exercise program into your daily activities. Anyway, I hope you enjoyed it. Thank you for listening. If you've got any questions, I will endeavour to answer them.